In today's session, we are going to be learning about our women, pregnant, nursing. Do they need to fast for the minor fast? Shavasa B'Tammuz, Asar B'Teves, Yom Gedalia, Tainus Esther, those four minor fasts. We're not going to be covering Tisha B'Av and Yom Kippur. We can only do one thing at a time. So these fasts, they get grouped together. The question is the other fast. There is a tremendous amount of literature, of words that are written on this topic, of rabbis who discuss this topic. We'll see if we could get it all in Siyata Dishmaya in our 40-minute session or so. We'll just start from the actual Shulchan Aruch over here. I mean, we could already start from the tour. We're in Siman Tavkuf Nun. That's the Siman that we're learning. So the truth is, the tour doesn't even he's not even addressing this over here. Tour isn't even addressing it, right? So you can't really start from the tour on this issue. You're gonna have to go straight to the Shulchan Aruch. The Mishnah Berurah, well, the Shulchan Aruch over here, rather, the Ramah, really comes in over here and he says, the Ramah says, Ubrois umenikois, pregnant and nursing women, shemitztaros harbe, that have a lot of pain. Ein lehisanos, they shouldn't fast. They're not allowed to fast. But filein mitztaros, even if they're not in pain, einin mechuyavos lesanos, elishnagu lahachmir. They're not obligated to fast. The custom is to be stringent. So it's clear from the Ramah that a pregnant or nursing woman who is in a lot of pain shouldn't fast. Fine, that's one category if they're in a lot of pain. Let's say they're not in a lot of pain. It's pretty clear from the Ramah that the custom is to be stringent and fast. This is only talking about the three fasts, and all the more so Tainus Esther, but Tisha B'Av they're going to be obligated. Tisha B'Av they're going to be obligated. There's a full-fledged obligation. Tisha B'Av is another discussion. That's in Siman Tov Nun Dalet, Sifim Hey and Vav. And Vav. So we clearly see from the Ramah that the custom is to be stringent if someone isn't in pain, even if they're pregnant or nursing. The question is if they're in slight pain. The Ramah doesn't deal with that. The Mishnah Berurah comes along in Gimel and says it's logical to say that this, when are they considered a mi'uberes, pregnant? Smishah shehukar havlad, when you recognize the fetus, aka 3 months, similar to Vestos, which is discussed in your day in Hilchos Nida. Nevertheless, after 40 days of the creation of the fetus, that's also halachically considered a pregnant one. Regarding this, if she feels that she's in pain. But less than this, she's like other women if it's less than 40 days before the creation of the, after the formation of the fetus. And therefore, she has to be in a lot of pain not to fast. If she feels weak, she doesn't need to be stringent at all. That's the Mishnah Berurah quoting the Mora Uksiyah. The custom is to be stringent, Mishnah Berurah. He says if they are weak, they do not need to be stringent. Nevertheless, even someone who needs to eat, they should not be indulging in delicacies such as meat and wine. They should only eat what they need. Similarly, when it comes to children that are of the proper age to mourn, even though there's no obligation to educate them, even if they are 12, and even just for temporary, if they're not bar mitzvah, bar bas mitzvah, even just for a few hours of the day, nevertheless, it is fitting to educate them. They shouldn't be eating delicacies. They should just eat what they need to eat
That's
in
another
order
law,
to
right?
join the mourning with the congregation. This is the Mishnah Berurah. So in other words, we see pretty clear if we just close this far now that the only way that it's permissible for a pregnant or woman or a nursing woman to eat is if they're in a lot of pain. If they're in a lot of pain or if they're weak. If they're in slight pain, the Ramah doesn't discuss that. If they're not in any pain at all, it seems like the custom is to be stringent. That's what it seems like from this Mishnah. There are a lot of poskim which discuss this issue and how potentially that nowadays one could be more lenient, specifically for women. I'd like to first not present that side, but I'd like to take this opportunity to spend around 10 minutes to go through some of the highlights of the Shalos and Chuvas Mekadesh Israel Rav Harfenis. Some of what I thought was the highlights, where he discusses this topic in particular. In this Shiloh over here in Simon Bays, he discusses women who aren't pregnant or nursing. Do they need to fast or not? He says they're obligated, but they have what to rely on if they don't. Why? So basically, what's happening over here is any woman who is of a childbearing age, there could be already more leniencies. Also, with the weather and with other issues, there could be more leniencies. Rav Harfenis takes those ideas and rejects it. And he differentiates in short between what used to happen and nowadays. Nowadays, there's a tremendous abundance of food. Even people who are poor, they don't have issues with food because of the government programs, the food stamps, vouchers. You have Tomchei Shabbos. You have all sorts of organizations which help with the food. People do not have issues when it comes to food. It's more like paying rent. It's more like appliances.
Tuition.
Right, tuition, there's breaks on that. Insurance, there's Medicaid is taken care of. So it's more on other matters, transportation, things that don't get covered. But the food is not the issue. But back then, that used to be a serious concern. They really didn't have enough food. There was poverty and there wasn't enough food. And they were weak. The Ritva says, someone who doesn't eat enough and satiate him or herself before the fast, if they fast, that could be a danger. But that doesn't apply nowadays that we have Shefa Gadol, we have a tremendous abundance. And therefore, it's easier to fast because people fill up more before the fast. And therefore, it's not so simple to rely on this leniency that women don't need to fast anymore. And he discusses this more in this tshuva. Quotes Avni Nazir, a woman who's going to be getting married, right? Or who is able to potentially have a child. You need to worry. Maybe she's going to give birth and she needs strength. Right? She needs strength. But that could be when she's already pregnant or later on. So it depends on the exact date, especially if she's not married. That wouldn't apply. Quotes this idea in two shuvas. One of them is over here by Ruderman. Other Rosh Yeshivas are lenient for women who have children in the house that they don't need to fast because they're weak.
It's Rabbi Ruderman?
It's Rabbi Ruderman. Because the factor of children in the house, we're going to be seeing also about if someone needs to go to work, if that individual is going to be weaker. We're going to learn about that. I don't want to ruin anything now. But if there's children in the house and it takes a lot of energy to care for them, said over in the name of certain Rosh Yeshivas that they don't need to fast. This is the tshuva that we already learned together about eating in on a restaurant on a fast day, someone who wouldn't be fasting. Yeah, we already discussed that over here. If a woman feels healthy, she shouldn't go against her Ramadan, she should fast. But if she's asking a shayla, do I need to fast because it's difficult, then there's more wiggle room to be lenient. Right?
He said that before. If they come to us.
Correct. That's what we saw yesterday. Shalos Chuvas Divrei Yotzev Siman Reish Lamed Aleph is stringent if she's totally healthy and has no pain. If the fast is slightly difficult, so then she should fast until Chatzos Halachic midday. What you see is two interesting things from this Divrei Yotzev. Number one, you see the concept of fasting until midday brought down. Number one. Number two, you see an issue, a concept rather, which the Ramah didn't address, aka the Ramah only addressed the extremes. If she was in a lot of pain, she doesn't fast. If she isn't in any pain, then the concept is to be stringent. What about if she was in slight pain? Comes the Divrei Yotzev and answers that question. She doesn't need to fast. This is, I think, the tshuva that we saw the other day. If someone calls on the phone, you have to assess the situation and really know are they legitimate or not. They're just trying to weave their way out of a fast. We'll come back to that momentarily.
How do you know?
Um, We'll come back to that momentarily.
Okay.
So this is the phone tshuva over here. Discuss this in the next tshuva. In Siman Hey, talking about people who are very weak. Could they be exempted? You can't exempt them without. It's gonna. Oh yeah. Here's an interesting tshuva from the Igros Moshe. I actually looked this up yesterday. He's talking about someone who is weak, weaker in nature more than other people. He's considered someone who is sick. Choyle she'im bo sakana, and wouldn't need to fast. And also Moshe in that tshuva goes into if someone is working and the work is tiring work. So Moshe says Melech Shemayim, you have to work, and therefore you could break your fast in order to work properly.
Wow.
And he says you don't need to just stay home and not work and not break your fast. No, you could go to work and break your fast.
Is
Moshe
then what is
Tshuva.
the thing with
Tremendous chiddush. It was also quoted in the footnote of the Piskei Tshuvas, this tshuva, at least the source of it. It's tremendous chiddush, and this is in the Igros Motion or in Or Chaim Chelik Daled Kufya Daled. He says Ayin Cham. If you look up the tshuva, that's what he says. I looked it up yesterday.
About the guys who were
You can look it up.
Clay Kodesh.
With working, not Klei Kodesh, a job of importance that needs to be done, especially even if you're an employee, your employer needs you.
a surgeon?
So
Interesting.
yes,
Wow.
it's a very nice tshuva. Like I said, Piskei Tshuvas. Over here he quotes again this shita of Rabbi Ruderman. Also, I saw this in another place. I think it was a footnote in Piskei Tshuvas B'Shem of Shach that many Rosh yeshivas are lenient for women who have small children in the house, and it takes a lot of strength. B'derech klal hein chalushos. The norm is that they're very weak. It requires a tremendous amount of energy. In brisk, they take a lot out of you. In brisk, they wouldn't fast in this case, and that's something to keep in mind. Here's an interesting story with the Belzer Rebbe over here. After the davening, people were lining up to ask the Rebbe if they need to fast or not. So he basically told all of them, you don't need to fast. So one person is standing by the side over there and seeing what's going on. He says, let me get my way out of the fast also. Right? He's saying, let me get my way out of this fast also. All right. So he waits his turn online. He approaches the Rebbe and he says, can I break my fast? He says, Lama lo. So he said, well, when I fast, I feel hungry. I feel so bad. So the Rebbe answers, on the contrary, right? That's the purpose of the fast, so that you become weak. And he didn't want to let him off the hook for fasting. In other words, you have to know, does the person really need
So he
to
knew he
break
was
it
trying
up?
to find that.
Exactly. So you have to know exactly what's going on. Is the guy just trying to find a heter, or is he legitimate? That's what you have to try to figure out over here. Okay. These tshuvas over here is what we already saw: rinsing your mouth out on a fast day, going to the dentist. We saw that yesterday, and then the closing tshuvas is bathing and going to a swimming pool on a fast day or showering, which we also had multiple sessions on. These are the tshuvas in the Mekadesh show. Exactly 10 minutes, like I said. That being said. And the pashtus of the Shulchan Aruch is that pregnant and women and nursing women who aren't in pain should be fasting. This Ketshuvas over here says that many poskim nowadays write that nowadays any pregnant or nursing woman is included in the category of a mitzdaros, someone who is in pain. Consequently, they do not need to fast. They do not need to fast. Certainly, if she recognizes that if she fasts, she was going to become weak and be in a lot of pain, even if right now she's healthy. And she could eat immediately in the morning. However, she shouldn't have delicacies such as meat and wine, like we said. She should have simple food. So many poskim say nowadays. Okay, pregnant and women and nursing women. Okay, according to the Mishnah Berurah, we already saw this. What's considered pregnant, what's considered nursing. Even though you shouldn't go against the simple explanation simple reading of the Ramah, and that they should be fasting if they're healthy and they don't have any pain at all, and she has enough milk to give her child. Still, many Gedolei Hador are lenient for women not to fast for these fasts because we're weaker nowadays. However, he says you cannot be lenient unless you consult a chacham. So there's extensive footnotes on this topic over here. We already have a Shulchan Aruch in Siman Tavkov Nun Daled Sif Hey. Many others. All the sources you could go through over here. It's in Aruch HaShulchan, and there's a lot of sources. You know, you just go through, you keep seeing more and more sources over here. You just keep skimming this, you keep seeing it over here. Look up footnote 4, for example. Tremendous amount over here. So, the more Hasidish you get, usually the more lenient you get. That's the tricks over here. I just like to focus on a few nuances other than just sources that are being quoted. Down here in the middle of footnote 5. If she feels any pain while she's fasting, she should eat immediately. The Chut Shani says if the weather is going to be very hot, shouldn't fast at all. Certainly, you need to worry about zeros later. What does that mean? Premature childbirth. Preemie. You have to be careful by her fasting. That could cause medical issues. This is discussed more also in Hilchos Tisha B'Av. It could cause nausea, vomit, dizziness. You need to
So
start.
it seems like also like women who the heck the Vlad isn't heck yet, but they get you hear about
Same
that
thing.
about morning sickness when this is
The end of the day, it's the question is going to become if the person's going to be in pain or sick or very weak. That's what it comes down to. Then it's not going to matter if you're pregnant and nursing or not. That's what it comes down to.
Did we see, because I thought the Rebbe mentioned something about heter for women, just stamazai.
Yeah.
Did we see that?
Yeah, that's what we saw a
And
little bit.
that-
That was what Rav Harfenus was against.
That's what he was against.
And we saw the little children thing. That's what he was against.
He was against just a blanket heter for.
Yeah, just because they're weaker or whatever. That's what some Chassidim want to say. And others.
There was no
controversial.
Litvish people.
Probably. I mean, you already had Rabbi Ruderman coming with that surprising ruling.
That was.
With the ruling of if they have the little children.
Like the little children.
Okay,
they
still.
without the little children.
Okay, still. That there's not in Shulchan Aruch. That's not in Mishnah Berurah.
Right.
Over here, he talks about something very important from a medical perspective. If a woman is nursing, and now because of that, she's not going to have enough milk, right? Even if it's supplemented a little bit with formula.
No, he says, yeah.
Rov tizdoinus hatinok betachlifi chol of aim. The majority is coming from the mother. You got to be careful. You got to be careful not to mess up the milk flow, especially on newborns.
Right.
No, in Hilchos Tisha B'Av over there in Siman Tavkuf Nun Daled, they deal with the most lenient a woman could be is if she's within 3 days of just having a child. The next level is 7 days, and then the next level after is 30 days.
After she gave birth.
After she gave birth, within that's when they're the most weak, and the children need it the most also. Yeah. Tisha B'Av is also there. Yeah. So truth is, the real proper way to learn this is we learn about it in this location, then we go over to Hilchos Tisha B'Av, and then we go to Hilchos Yom Kippur about fasting. That's how you get a real good understanding of the topic at hand over here. Look at what he says over here in footnote 8. Many Gedolim who were lenient for them, talking about all the sources. Be lenient. She's Koyach Lahilid Bonim, Shal Jubas Teferes Svi. I mean, the list just keeps going over here.
Right.
Weather, same factor again. Rav Shlomo Zalman Auerbach. Shlomo Zalman Auerbach himself seems to be coming in with the leniency. The Tisha B'av and Yom Kippur, they need to, for sure, to be more stringent. Then he says, look, you asked about a children needs to deal with children, she's exempt from these minor fasts. Same exact story. Okay? He says over here that if a pregnant woman, it's also for her to fast because many women miscarry because they fast.
Wow.
That's already intense language over here. Yeah. He wants to say nursing woman, she's exempt for a year and a half. Even if the child's eating other foods. After a year and a half, she should fast. I mean, these are tremendous leniencies that you can't imagine. Most children nowadays, they're not nursing off the parent after like a half a year or so. A year and a half, she's way done with their mother's milk after a year and a half. Right? Only if the fast was a tainis nidche, then you could be lenient. Even if she's not nursing at all until 24 months. Seems like she had to be nursing that whole time, but tremendous leniencies we're seeing.
People need to see over here.
Charles and Chuvas, Rabbi Kiva Yosef Schlesinger quotes a Chassam Sofer. He only allowed his daughters to fast on Tisha B'av and Yom Kippur. Brisker Rav, Rav Shach, Rav Uderman, all these Rosh Yeshivas. We said before. He said they were lenient for women in general, especially if they had children. Especially if they are within 2 years that they just gave birth, even if they're not nursing at all. However, since the simple explanation of the Shulchan Aruch and Poskim is not this way, can't be lenient without asking the child.
We're saying this is muck, but at least you see over here a little bit. You see,
Yeah.
the Hakel Matzamos, that it says, but Brat Sheesh Lam, the Lashon there is mashma that Stam women and Zay.
Where's the rock?
Yeah. Shayumarim Lanashim
Yeah.
Hakel Matzamos, right?
Yeah.
But Prat, and especially,
Yeah.
So it's mashma that.
Even without that, there's wiggle room to be
Right, there's
lenient.
wiggle room.
That's what I'm saying.
Again, I'm not saying it's right, but I'm just saying
No,
it seems to be that
he's saying it's not right. He's saying, look,
Right, no,
since it's against the simple explanation of what it says in Shulchan Aruch, you can't just have a blanket
that
leniency.
is a heavy lineup of
Oh yeah, that is. At least minimally, they should fast 3 hours until midday. Here's your midday again, Chatzos.
Okay.
You should be careful not to publicly so that you don't belittle the fast.
It's fast.
Look, that's why this is hidden at the end of a long footnote over here.
Right.
This is information that the Hamonam has to be careful about hearing if they're just hearing it out of nowhere.
Right.
That's why I'm not presenting this information in the first 2 minutes that people listen to. If you're already 25 minutes in, then you already understand something that's going on over here. Yeah.
100%.
For the average person. You hear what we're saying, David? So what to talk about over here? David, any questions?
Age brackets, it looks like, a person's older, the 70s, 80s. I don't think we saw anything about age brackets.
Age brackets?
I didn't say the chalash, I understand they're weak or whatever, but you would think that there'd be like an age bracket, like 70s, 80s, that all of a sudden
No,
the person's weak.
No, that is the weakness.
No, it's
Yeah. David, you good?
Yeah. Yes.
David's not so talkative lately.
the hard night's sleep.
David, where are you?
Where I daven in the morning, I'm upstairs.
Davening room upstairs?
No, it's a room upstairs.
Okay.
Yes.
Where is?
I can barely hear him.
Oh, I'll speak louder.
Who do we allow to eat? Okay. Men who are weak. Older people. Older people. Okay. Thank you very much. When they have a lot of pain. Okay. And based on what the doctor said that the fast could damage you, even if you're not sick, you shouldn't fast on these 3 fasts in Tainus Esther.
The Reb mentioned also persons taking, like the older people always take medicine, take a lot of medicine. They have to have food with it, or they have to drink something.
Right. That's what we saw the other day. Every posek has to assess, use his scale of psak, and judge what's the word, deliberately? Is that the word?
Judge,
Judge bin Maecenas. Slowly,
no, Judge,
patiently,
Tiller,
because people want to fast, and sometimes they shouldn't be fasting, they're sick. All right? You don't have to fast until you faint. All right? You're in a little bit of pain, you got problems.
Why is it? Why do you,
Oh,
why
wow,
do
a lot of
people,
words. Or if you have stomach pains or you're vomiting,
why do
or
people,
you have dizziness or vertigo, or you're weak more than usual, which is normal on a fast. You're more than that. You're exempt from fasting. Even if someone's healthy, but he had a heart attack recently, or it's something with his brain or stroke, whatever, he's exempt from fasting. Someone who's taking antibiotics due to inflammation or a fever is exempt from fasting. Certainly, someone who takes pills don't need to fast.
What is to be like just taking
Natural.
natural
I'm not
natural.
sure.
It's like what, like vitamins?
Not sure. I don't know if vitamins would pass. Up until 3 months after a surgery, even if it was a light surgery, if it was a surgery nevertheless,
You put on.
don't fast. Don't fast. Tell this to the mothers who are getting Botox. Maybe they'll go off.
right,
They probably wouldn't be fasting anyways. Similarly, a person who's weak, if they fast in these times, and it could prevent them from fasting on Tisha B'Av, better to fast on Tisha B'Av and not Shabbat or B'Tammuz. You have one option. You know you can only fast once.
Okay.
That's a tremendous line right there.
This piss.
Tremendous insight over here.
Piss was sometimes I got very thirsty. I was like more than normal.
Yeah.
But I held off and I was fine, but
He says on the other side of the coin, you have some people who they're not just trying to fast when they shouldn't be fasting, but you have other people who are trying to worm their way out of a fast when they should be fasting, and they're just looking for a heterium. You have to be careful about that. So you have to know if this is the situation.
that guy tells her up.
Oh yeah, exactly. Okay. He says if you could get along with shiurim, eating minimal amounts of food, even on Shabbos or B'Tammuz, and you're healthy, then you should do that.
What's the Kediachilas cost for like a drink? Less than a Revius, I guess?
Yeah.
I guess you have to go by the minimum, sure, we say 2.9.
2.9 food ounces. Time now.
So 2.9, 4.4, and 4.4, and 5.1.
Yes. 5.1 was Chazanish.
5.1. Chaim now is the
2.9, correct.
was it 3.3 or 4.4? I always mess that up.
I think it's in the fours. Not sure. The postscript nowadays say if someone is healthy, but he's being involved with the Tzalas Nefashos, doctors, nurses, PAs, etc. Right?
Soldier.
People fighting, soldiers, etc. These types of jobs, they need to have focus, a clear mind. That's difficult to do when you're fasting. If there's a shaila in those cases. A worker who is working, and because he's working, he will become weak and he will not be able to continue to fast. Mikra Adin from the letter of the law, tremendous heter. It's explicit in the Shalos of Chuvas Igros Moshe we just saw. You don't need to stop working. Tremendous heter. Keep working, and if you become weak or you're sick, eat. Explicit in Moshe Feinstein. Where was that again? Shalos Chuvas Igros Moshe or Chaim Chelik Daled, Simin Kuf Ayin Daled. Towards the end of Chelik Daled, he has fascinating chuvas over there, by the way. He talks about what to do, tshuva for Mishkav Zachor, if a person was Moitzi Zar Levatal. I mean, fascinating chuvas over there. Fascinating. What the tshuva process is, it's something to think about nowadays.
Yeah.
Yeah? Yeah. Well, there's sorts of very interesting shuvas there. Certainly, a person is able to go to shul and go to learn Torah, Kedusha, and the Beis Medrash. Even though that by doing so, he's going to be weak, and then he won't be able to fast. He'll get sick. He doesn't need to remain sleeping in his house all day in order to fast. Which, by the way, we are probably going to say on Yom Kippur, but we're not learning Hilchos Yom Kippur right now. We're talking about the other fasts. Okay? In other words, on these minor fasts, you could go about with your daily activities, even though Hagam, that because of that, you're going to need to break your fast.
Even if you
People don't know that this tshuva of Moshe exists at all. They have no clue. It's the mother of all leniencies. By the way, there's an example. People think, oh, halacha, it's boring, bunch of stringencies, there's all chumras. You learn halacha, you see how to walk. You see leniencies of belado lo yarin isha Yisraeliyas yadavis ragu without learning halacha. Zok the chafetz chaim is an ogdam and a chelik aleph. You're not going to be able to lift your hands. You're going to be a walking isser. Well, you got to know halacha l'maisa. That's why we're here. Big tshuva from Moshe over here. Now, this is fire. Tremendous leniencies. Tremendous leniencies. So let's say you have a woman. She's pregnant or nursing. She's got little kids. And she's working.
You're right.
She's got every leniency in the book. Look, at the end of the day,
I have to see how you.
I'm going to tell you what I told my chavrusa, right? All right, I figured we weren't going to be able to finish this in one session,
Okay.
but this was an excellent start.
Yes.
This was an excellent start. Rome wasn't built in a day, they say. Look, I'm going to tell you this. One of my chavrusas came in yesterday. I'm not going to say who. I'm not even going to say who. Someone came to me and said, look, I spoke to a rabbi. I spoke to a well-known doctor, whatever. You know, the machlokes between the rabbi and the doctor is how much could she eat on Tisha B'Av? My pregnant wife. Does she have to do shiurim or could she just eat totally? I said, oh yeah, okay. Let's open Siman Tov Kuf Nun Dalet.
The doctor said she could eat whatever she wants without.
Yeah. The doctor's a big poisek now. The doctor, he knows all of halacha. He knows all Dalet Chelki. Yeah, okay. If he knows Dalet Chelki, Shulchan Aruch, and Torah, and the Noisei Kelim, so why doesn't he open to Siman Tov Kuf Nun Dalet Sifhei? It says over there, stayed in the Shulchan Aruch that a Meuberes has to fast on Tisha B'Av like she fasts on Yom Kippur. Close case. You go right to the Sifav, it talks about a Minekes if she's nursing. And the leniencies associated with that depending upon the stage that she was nursing.
Right.
Where does it say anywhere over there that if she's that a pregnant woman doesn't need to fast on Tisha B'Av? So if you look at the Mishnah Berurah over there and everything, you'll see if someone's maybe weak or in pain, especially in pain, fine. But if she's not in pain, what's that there? So you look over there, the Piskei Teshuvos, he brings a lot of parallel and like a duplicate of what we saw today. That if she's going to have the dizziness, if she's going to have the nausea, everything, you have to make sure that the fetus doesn't get negatively affected.
Who's the one who said that that it could cause stillborns?
Yeah, we saw that in the footnote. Someone said the thing.
Someone said
you have to know the mitzvahs. If she's going to be in AC all day, she has help with the kids anyways. She doesn't need to do much. So then you have to know the exact case. A person can't just come in before a fast and give up psak. You don't need to fast. The ikar shaila is, are you going to be in pain or is it going to negatively affect you from a medical perspective?
Right.
If the answer is no on both, then what's the heter?
Right.
What's the heter for a pregnant woman?
Mm-hmm.
All right, Mitzvah Hashem, tomorrow we'll continue.
Right.
Yeah.